Hey, welcome to Medicare 101. I'm Randy Bond with Bond Insurance Solutions in Fort Smith, Arkansas. Today we're talking about Medicare Advantage Plans. Medicare Advantage Plans are also known as Medicare Part C. So let's talk a little bit more about Medicare Advantage. First thing to know is that Medicare, original Medicare, was never designed to cover all of your cost. There's always been cost sharing involved, but the second is really important in that Medicare has no limit on your cost sharing. There is no cap on how much the bills are that come in for medical services that can come your way. So as you see on that picture on the left, having just original Medicare with no extra protection can almost be like walking a financial tightrope over Niagara Falls with no safety net. And so Medicare understands this, that if you are just on original Medicare, you could be just one health crisis away from having a financial crisis on your hand. So Medicare gives you a couple of options on how to offset or reduce the out-of-pocket costs that come your way. In our last video, we talked about Medicare Supplement Insurance, and you can see a link to that right here if you want to check out Medicare Supplements. And so one option is to get a Medicare supplement and get a standalone Part D prescription drug plan if you need it. And most people do. The second option is a very different option known as Medicare Advantage. Medicare Advantage is also known as Medicare Part C, and this works a lot like individual insurance or group benefits. And we'll look more about how all of that plays together. But basically, Medicare Advantage is just simply Medicare through a private health insurance company. So what are Medicare Advantage plans? Well, Medicare Advantage plans, or MA plans, we'll just shorten that to MA. MA plans are a type of Medicare plans offered by a private health insurance company that contracts with Medicare to provide you with all of your Part A and Part B benefits. So again, a Medicare Advantage plan is Medicare through a private health insurance company. So where this is different than a Medicare supplement is that a Medicare supplement works side by side. Medicare Advantage is where Medicare takes a back seat, and then your Medicare Advantage plan is who is actually taking care of you. In fact, if you're enrolled in an MA plan, Medicare services are covered through the plan, and they're not paid for, services are not paid for under original Medicare. All that original Medicare is doing is paying a premium to the insurance company that's taking care of you. So that's all that they are doing. Now, that's a big deal. It's providing a big help for you. But that is all that they are involved in. They're not involved in the billing process or making decisions about your health care or anything like that. If you sign up for an MA plan, the plan is going to be the one that is handling the billing and payments and so forth. So most MA plans, and here's a really nice thing about a Medicare Advantage plan, is that they include prescription drug coverage, usually at no additional premium. So that's a way to be able to save right there on your monthly cost. Now, if you have an MA plan with prescription drug coverage, these are known as MAPD plans. Important thing to note again is that an MA plan is not Medicare supplement. And a Medicare supplement is not Medicare Advantage. I hear a lot of people get this confused, and it makes it kind of difficult to help them sometimes. But I just want you to know that a Medicare Advantage plan is something entirely different than a Medicare supplement. So why should you consider an MA plan versus, say, original Medicare? Well, there are some advantages to a Medicare Advantage plan, which is why they're called that. Number one is that they have a safety net. Two, they have lower costs than original Medicare in many places, and they can offer additional benefits that original Medicare does not. So the first is that safety net. Every single Medicare Advantage plan has a maximum out-of-pocket. And Medicare for 2020 has set that maximum out-of-pocket for plans at no more than $6,700. Now, some plans have lower MOOPs, maximum out-of-pocket. And so whenever you reach that maximum out-of-pocket, that's where you stop getting bills. So if you had a really expensive year, once your copays and once your part of it adds up to that maximum out-of-pocket, whatever that number is for that plan, that's where you stop getting bills, and that's where the plan will pay 100% of everything for you. So this is a big difference between original Medicare and a Medicare Advantage. Original Medicare has no safety net. So you're on that tightrope and you could blow off or fall off and you got a crisis. With um, a Medicare Advantage plan, since it has that maximum out of pocket, it has a safety net. And that can help to prevent a health crisis from becoming as big of a financial crisis. And that can make all the difference, especially when you consider that you might be able to get a Medicare Advantage plan at, at low or no additional premium to your Medicare Part B premium. And so this is a nice way to be able to add on a safety net to your Medicare at low or no cost. Now, speaking of cost, a lot of Medicare Advantage plans can save you on your cost sharing. Many Medicare Advantage plans have reduced or even include their co-pays and co-insurance and deductibles within the plan, so that reduces your cost. For instance, in a number of plans, there may not be a deductible at all. So where you do have deductibles on Part A and Part B on original Medicare, you might have a Medicare Advantage plan that has zero deductible. And so it immediately goes into some co-pays that you would have on the MA plan. But those deductibles, I'm sorry, those co-pays can be very low in comparison to original Medicare, or even zero, which can be a huge cost savings for you when you're accessing healthcare. So again, one of the key differences between a Medicare Advantage plan and a Medicare Supplement. With the Medicare Supplement, you're going to pay a monthly premium. But the nice thing with the Medicare Supplement is that you may not be paying very much when you're actually accessing healthcare, but you're paying that premium whether you're seeing doctors or not. On a Medicare Advantage plan, you're basically paying when you go to the doctor. Some plans do have premiums, but they tend to be lower than Medicare Supplement premiums. And then when you actually do access healthcare, your copays are oftentimes lower than original Medicare. So a Medicare Advantage plan could save you on your healthcare cost. Now, they do have additional benefits. Not every plan has these benefits, but I remember a good friend, we call her Grandma Shirley. She's just a sweet, sweet lady, dear person. Everybody needs a Grandma Shirley in their life. And Grandma Shirley told me one time that every senior needs eyes, new eyes, ears, and teeth at some point in their life. And I know a lot of seniors are looking for these kind of things. And one of the nice things about a Medicare Advantage plan is that where original Medicare does not include coverage for routine vision, dental, or hearing, many Medicare Advantage plans do. Now, Medicare Advantage plans vary by market. So depending on what county or zip code you live in can make a difference on whether or not these benefits are there or how rich those benefits actually are. And so that's something we can help you do, is see if that is there, what is available. But that can oftentimes make a big difference for people who may not be able to afford a standalone dental vision hearing plan, to have that included all in just one plan. So one of the advantages to having a Medicare Advantage plan is you got all your coverage in one plan. You don't have to have 3 or 4 different cards from 3 or 4 different companies to get all the coverage you need. You've got one card that you take to your doctor, the hospital, the pharmacy, the eye doctor, the dentist, even maybe to the gym if it has a free gym membership included in there. So those can be some nice additional benefits. Now, MA plans come in a variety of different flavors, so they operate a little bit different. You might have a plan in your area that is a PPO plan. You know, the 2 most common types of health insurance for individuals or group plans are HMO plans or PPO plans. Again, MA plans work a lot like individual and group plans, where you have copays when you go to the doctor and so forth, but also in the way that they're set up as either PPO or HMO plans. So an HMO plan, you can only use doctors in the network. So the plans typically have a network of doctors that they work with in hospitals and providers like that. And on an HMO plan, you can only use those doctors and hospitals that are in the network. With a PPO plan, you have a little bit more flexibility. You can use in-network doctors or out-of-network doctors, but typically you would pay more if you used an out-of-network doctors. And there are what they call private fee for service plans. These plans can be a good option, particularly if you're traveling. They work a little bit differently than the PPO and HMO plans. They don't necessarily have the set copays, although many times they will. But they don't have as strict of a network to work with. You can take them and ask the doctor, would you accept the terms of this plan? So for people that are traveling, this can be a good option there. There are also special needs plans that may be available in your market. They're not available everywhere, but some places do have them. So they can have richer benefits for people that have maybe both Medicare and Medicaid, or if they have certain chronic conditions like diabetes or heart problems, or maybe some other condition that they specify there. Kind of a newer thing that we're seeing is Medicare savings accounts plans. This is where you have a high deductible plan, and Medicare puts a little bit into like a savings account that you can use toward that, but the deductibles are very high on those, and you pay all that before the plan kicks in. And again, these can come with or without prescription drug coverage. And so we want to try to find what would be the right match for your situation based on the doctors you're seeing, medicines that you may or may not be taking, and many other factors like that, what additional benefits that they would have. So here's some facts. Now, when you have a Medicare Advantage plan, contrary to a popular myth that is out there, you have not left Medicare. You still have Medicare, and so you must continue to pay your Medicare Part B premium unless the state is paying for that for you. Now, if you are low income, there are programs available for you that can help to pay that Part B premium. And if you're not certain about that or want to know more, by all means, hit that contact us button. We can get you a little more information about that. But in order to have a Medicare Advantage plan, you do have to have both Parts A and B on original Medicare and pay that Part B premium. You get the convenience, again, of one single plan that you use everywhere for everything. Now, on a Medicare Advantage plan, your coverage can be limited and is often limited to a certain service area. So generally within the region around you. But most of the plans, if not all of them, would have coverage for ER and urgent care visits anywhere you go in the US. And some of them even have coverage outside the US. So that can give you a little bit of flexibility so that if you are traveling, most of the times when we're on vacation, we're not doing routine kind of doctor visits. We're only going to the doctor if we really have to, because we don't want to interrupt the vacation. So one thing to know is that the plan premiums, the benefits, and the terms can change from year to year. So Medicare does give you that opportunity every fall during the annual enrollment period of October 15th to December 7th every year to review your plan and to see if maybe there's some better benefits with another plan, or if you just need to stay put where you are. If you like the plan that you're in, you're okay with any changes, if there are any with your plan, you don't have to do anything. As long as the plan is going to be around the next year, you'll just roll over in your enrollment in the plan and you have to do zero. So it's very easy to continue in a plan. But I always like to encourage people to take a look, particularly if they have prescription drug coverage, to see if maybe they can save money on their prescriptions with a different plan. And so we do that every fall with our clients. Now, on the plans, again, you may or may not be required to see doctors and hospitals that are in your plan network. And that really depends on the type of plan that you have. And so that's one of the things that we look at is, are you going to be traveling a lot? Are you looking at using hospitals and providers or doctors outside of the geographic area that we might be in? Because we want to find the right kind of match for you on an MA plan. And some people will ask me, can I get a Medicare supplement with a Medicare Advantage plan? And the answer is an absolute no. Medicare supplements and MA plans do not work together. They're not designed to work together. You will be frustrated if you were to somehow do that. And I say somehow because it is illegal for an agent to knowingly offer to sell you both of those at the same time. Now, we can tell you about both of those, but if I know that you're going to sign up for a Medicare Advantage plan, I cannot offer you a Medicare supplement to go alongside. Now, there are things called hospital indemnity plans that you can have to go alongside, because one of the biggest copays that you might face with a Medicare Advantage plan or even original Medicare would be a hospital stay. And so a hospital indemnity plan can help offset or even eliminate that copay for you, and that can save you quite a bit. And those are really inexpensive on a monthly premium to get. So how do you choose an MA plan? Well, what we do is we sit down and we start, if you'll let us, by looking at your medications, particularly if this has a prescription drug plan included in it. And we want to make sure that your medications, number one, are going to be covered and that they're going to have the lowest cost, and that your pharmacy that you like to use is in the network. Now, there is a whole lot more detail that I could do on prescription drug coverage, and we've done that in another video. I'll put that link right here if you want to see how prescription drug plans work. There are some complexities with those, and particularly if you're taking a lot of medications, it would be good for you to be familiar with that. Second thing that we want to do with a MA plan is make sure that the doctors that you like to see are in the network. We want to try to minimize any kind of change that you would have to do. We know that when you're getting into the senior years, change can be difficult. And so especially if you've got a good relationship with your doctor knows your health history, knows and has been doing a good job of treating you. We don't want you to have to change your doctor in order to get an MA plan. We'd rather change the plan to fit the doctors that you've got. And the third thing is that we want to compare the plan cost. We want to see which one has the better benefits for your situation. And we want to look at maybe some of the additional benefits. So if we've got two plans that are, just about the same side by side as far as how much you'd be paying for doctor visits and hospitals and other kind of care, then we may look at, which is most important for you, dental, vision, or hearing. And we can kind of match that up to see which plan might have richer benefits than that to get you to where you want to be and get the coverage that you need. Another thing that we might consider in there are star ratings. Medicare, if a plan has been around long enough, will assign a star rating to plans based on how well they've been taking care of their clients, how well they've been accessing the health care, how satisfied they are with the plan overall. And that works on a series of 1 to 5 stars. And then once you do find the plan that you like, we need to see if there's an applicable enrollment period that we could sign you up. You can't sign up for an MA plan just any time of the year. You've got an opportunity when you're first eligible for Medicare, called your initial enrollment period, that you can sign up. You've got the annual enrollment period, but there may also be special enrollment periods that during the year that you might be able to qualify for, but we would need to check your specific situation in order to see if you would qualify for one of those. Sometimes we just have to wait a few months in order to get you on the plan that you would really want to be on. So if you would like to know more, if you have questions about Medicare Advantage plans or want to check out one for yourself, you can call me at the number there on your screen. You can shoot me an email. We can also do in-person appointments. Now, if you're far away from Fort Smith or you're just not comfortable with being in person right now with all the coronavirus things going on, we can certainly do a lot of this just by phone or even in a platform like Zoom or WebEx or something like that, so that we can just take care of you and make sure that you are fully understanding what your options are and helping you out fully. Now, I am a licensed independent agent. I'm licensed in Arkansas, Oklahoma, and Texas. If you're in those areas, we'd be delighted to help you out. If you're outside that area, we encourage you to find an agent there. We might be able to help you find somebody if you want to just shoot us an email, but I can't always promise that. Don't have that vast of a network of people. Now, as an independent agent, I don't work for the federal government, don't work for Medicare, nor do I work for any particular insurance company. We are able to be unbiased and help you to find the right match for your situation. And so we are here. You can see that we try to take more of a teaching approach and just try to help you find what's right for your situation. Hey, thank you so much for joining us today. If you found this helpful, we hope that you'll like or share this video with somebody else, or maybe even subscribe to this channel. We would really appreciate that, because we're going to do updates on Medicare and keep you well informed as best as we can. And if we can help you, by all means, please contact us, hit that contact us button or give us a call, and we would be delighted to help you out any way we can. Thanks again for joining us. We look forward to seeing you next time when we talk about, should I go Medicare Supplement or Medicare Advantage? Thank you very much.